Dr. Nardi here, back with another video. Today we are going to explore the architecture of the mirror by looking at how we construct, distort, and evaluate the self. When we think about who we are, we often assume the self is a single entity, but it is actually a multifaceted structure of schemas. These self schemas are collections of beliefs about our nature, unique qualities, and typical behavior. They are developed from past experiences and help us process information about ourselves in areas that are important to us, like being an athlete, a student, or a friend. Our beliefs about ourselves do not just cover the present, but also the future. Hazel Marcus introduced the concept of possible selves, which are our conceptions of the kind of person we might become. We have hoped for selves that act as blueprints for our goals and feared selves that represent what we want to avoid. Interestingly, research on older adults has found that having health-related possible selves is linked to fewer depressive symptoms. Specifically, the presence of feared selves was a strong predictor of better mental health because it motivated people to avoid negative health outcomes. Sometimes there is a gap between our perception of who we are and our personal standards. Tory Higgins developed Self-Discrepancy Theory to explain this. He identified the actual self, the ideal self, and the ought self. When your actual self fails to match your ideal self, you likely feel dejection-related emotions like sadness or disappointment. However, if you fall short of your ought self, which is who you think you should be, you experience agitation-related emotions like anxiety and guilt. We manage these gaps by either changing our behavior or bringing our ideals more in line with reality. We also define ourselves through social comparison. Leon Festinger proposed that we compare ourselves to others to assess our own abilities. We use reference groups as social benchmarks. An upward social comparison involves looking at those who are superior to motivate ourselves, though it carries a risk of discouragement. A downward social comparison involves looking at those who are worse off to protect our self-esteem and feel better about our own standing. Culture plays a massive role in shaping this self-concept. Western cultures often promote an independent view of the self, where people see themselves as unique and self-contained. In contrast, collectivist cultures promote an interdependent view, where the self is seen as inextricably connected to others. This was famously illustrated in a pen study where American students chose the unique colored pen to express agency, while Indian students chose the common color to reflect group harmony. Our close relationships also sculpt us. The Michelangelo phenomenon describes how a partner who supports our ideal self can help bring our behavior in line with those goals, effectively sculpting us into the person we want to be. This is tied closely to self-esteem, which is our overall assessment of our worth. While high self-esteem is linked to happiness and persistence, it is often the result of success rather than the cause of it. It is important to distinguish healthy self-esteem from narcissism. Narcissists have an inflated and fragile sense of self-importance. They are highly sensitive to criticism and may react with aggression when they experience an ego threat. The foundation of our self-worth often starts with parenting. Diana Baumrind identified 4 parenting styles based on acceptance and control. Authoritative parenting, which provides high support and firm limits, is considered the gold standard for developing high self-esteem. Authoritarian, permissive, and neglectful styles can lead to more tentative or confused self-concepts. Finally, we navigate the world through self-regulation and presentation, self-regulation is how we direct our behavior to reach goals. A major part of this is self-efficacy, which is the belief that we can achieve specific outcomes. We also manage our public selves through impression management, using strategies like ingratiation to make others like us, or self-promotion to highlight our strengths. By modifying negative self-talk, recognizing unrealistic goals, and approaching others with a positive outlook, we can actively build and maintain a healthier self-image. If you enjoyed this video, please like, subscribe, and share. I will see you in the next video.